Former Liberal MP and Premier State Consultant Fiona Scott and Claire March, Managing Director at Council House, former Labor advisor. Claire, to you first of all, I spoke to Peter Collignon earlier, infectious diseases physician and microbiologist. He's at the ANU and he said he was quite optimistic about the numbers in Victoria, that things are looking good for lockdown to end as scheduled on Thursday, Claire.
Well, certainly we're all very hopeful, and unfortunately for Victoria, we're all very well rehearsed at this, of course, aren't we? So, those daily updates of case numbers, I think a lot of us would have liked to have seen that be a lot better earlier on in the lockdown. But now that we're coming towards the end, it's enough there to, make optimists even out of some of us pessimists. We have seen a significant amount of government help been announced in recent days as well, which I think has lifted the mood. The introduction of the new regional tourism vouchers again, as well as today about $30 million worth of financial help for those doing it tough. So as well as the kind of, rolling news of case numbers, we've also heard from the Victorian government programs each day to back in the economic rebuild effort.
And Fiona, your thoughts on where things are at, and the Prime Minister's reiterating that message today that he hopes, and obviously depending on the medical advice, but he hopes that lockdown ends this week, that school kids have missed enough days of school.
Yeah, look, I don't understand, Kieran, why Victorians aren't more angry at Dan Andrews and the incompetent handling of this pandemic down there in Victoria. I mean, you compare Victoria to New South Wales. Victoria's had over 160 days in lockdown. New South Wales, 45. Victoria has had 31,000 return visitors internationally. New South Wales, 125,000. There is no excuse for this. There is no excuse for the way the Victorians seem to continue to have these issues and not be able to manage it properly in their community without locking down large portions of their state or large portions of their metropolitan cities. And, at the end of the day here, we are all Australians, but we do need to see that the Dan Andrews government can start to step up and manage this effectively. At Christmas time, we saw an outbreak here in New South Wales on the Central Coast, and the Berejiklian government was able to close down that region or shut that region to a point that people could still celebrate Christmas. And I think in many ways we have to have a safe community outcome. New South Wales has got it right, and I think what's going on in Victoria is it's a disgrace.
Claire, is there a part of this as well that the government is spooked by last year, where it did get away from their officials? This year, I think most would say that the health authorities, the contact tracing and so on, has been much more effective. But are they being so cautious because they've been spooked by the events of last year, Claire?
Well, I think, just picking up on Fiona's point there, what's vastly different about this outbreak than the Northern Beaches outbreak, and I think, everyone's in universal agreement here that if you could have it the way that the Northern Beaches hotspot was managed, you would, that was a fairly low impact on the community. The problem with this outbreak, of course, is that the number of exposure sites and the number of cases is spread all over the state, right into regional areas. So the idea of containing it just to one locale is just not really practical in this instance. So we're not really comparing like and like there, to be fair. Secondly, just picking up on, I guess, the psychology about how Victorians do feel about their government down here. I think, it's one thing, I guess, to commentate about your wish list when you're not in the state. But the reality is, the lived experience here is that the Victorian government have genuinely backed Victorians at every step of the way. And whilst they have been there with lockdown measures, they've been there with commensurate amounts of help and support through grants for local businesses, to regional tourism grants available for families to get out and about once the lockdown lifts, and another 10,000 added to the pool today. So, their response has been holistic and in keeping with what the community expect from a government that really deeply cares about the interest and welfare of the citizens of their state. And that is ultimately what is at the crux of this. I think where you compare that to the response from the federal government, you do get a bit of a contrast there around, here is a state government that's prepared to go line by by line and examine all of the human and economic impacts of this lockdown and have an
Claire,
answer
at the
for
end
it.
of the day, New South Wales has brought back internationally more than 3 times the amount of people Victorians have, and this has continued to get out in Victoria. 820 people have died in Victoria, 54 in New South Wales. You know, at some point, the spin has to stop. At some point, it has to be the facts are the facts. If you want to say about New South Wales, Victoria, and compare the two and throw in the federal government, I mean, the federal assistance to Victoria has been greater. The federal government is providing more vaccine to Victoria. Why is it that the Victorian government cannot keep pace with New South Wales? New South Wales has been pushing through with their vaccines. New South Wales has been going so well. And we can't say that there is genuinely a massive demographic difference between New South Wales and Victoria. And the fact that you're saying, yes, it's scattered through the state, well, the Victorian government need to be able to deal with that. It goes to show that there's issues with their contact tracing, there's issues with the way they've managed hotel quarantine, there's issues across the board. And you know what? It's just not good enough anymore. It's not good enough anymore to then sit there and say, oh, they're doing a great job. No, they're actually not doing a great job. They've done a really poor job.
I understand.
Claire,
sorry.
Before I go to you, Claire, for your response, just to further to Fiona's point, and I'll get you to respond to it, is that it's not obviously universal. Nothing is universal in politics where the government's going to be backed, but the dislike of this government by some, and I know from personal experience, friends and so on in Melbourne, is totally the opposite of what you said. It's visceral, the dislike of this government and the flaws of last year and the situation they're going through again. I know that the Premier and the Acting Premier, they've got their support, no doubt about it, those that are happy to, go with the government and think that they've been managing this appropriately. But I tell you what, it's not universal by any stretch, Claire.
Look, I understand that there are always going to be pockets of discontent, and some of those people have mouthpieces and opportunities to express that more so than others, and we've seen that. There's been a lot of the commentariat down here in Victoria that would take deep issue with my analysis just there, and they freely voice their opinions day in, day out on this in papers and programs like this. But I guess the point here is, so firstly on contact tracing, without a doubt, the consensus down here is from dispassionate, bipartisan, reviews, is that contact tracing is a world different down here to what it used to be. Secondly, the case here that we're talking about that led to this outbreak, let's be real, came from South Australia, not Victoria. So there's a little bit of facts here that sort of level some of these arguments.
Yes, but there's been cases from Victoria that has then come up to New South Wales, and New South Wales is dealing with them adequately. So yeah, and that's not an issue for New South Wales. Sure, it's not great what's happened on the south coast here of New South Wales, but it's not beyond the Berejiklian government to manage it appropriately without shutting down our entire state and making our children not go to school.
Yeah, well, just to be really clear, I'm not actually in lockdown. I'm in regional Victoria. I'm not currently, the entire state is by no means shut down here in Victoria. Only a small geographical area. Of course, that includes a large part of the population. But I guess, so the lived experience down here is very different to the assumptions that are made, I guess, from other states. Okay. The other thing we need to really remember is that every state is only one incident away from a similar circumstance. Like, no state is immune from an outbreak. This is a highly contagious disease. We don't have the infrastructure that we need from the federal government, which is patently obvious if you talk to any state premier in this state.
Okay. None are in Victoria. And actually, when you look at the per capita breakdown of support from the federal government, it's actually not more in Victoria. So, look, there's many more rooms for improvement here that fall in other areas of government. I think, broadly speaking, the Victorian government has been with Victorians every step of the way, and that plays out in the general mood in this state.
Fiona, thank you both for the chat today.